People are still coming in, so I'm gonna wait a minute or so before we get started. All right, it looks like the numbers are leveling off, so we can start. Hello, everyone, and welcome to the latest PediaTrust Q&A Ask the Pediatrician. Tonight's webinar is entitled Welcoming Your New Baby During a Pandemic. My name is Ruben Rucoba. I'm the medical director for PediaTrust and your host for tonight's session. Our panel tonight includes, and if you can, please give a wave so everybody can see who's who. Dr. Melissa Turner, pediatrician at Pediatric Associates of Arlington Heights, with offices in Arlington Heights, obviously, and Lake Zurich. Also with us is Chana Goldstein, a lactation consultant and the head of our lactation department at PediaTrust. A special guest tonight, Dr. Randy McCool, OBGYN from Northwest Women's Consultants, also located in Arlington Heights. Our session tonight will be an hour long. We're going to respect everybody's time and try and finish up promptly at 7 o'clock. But just be aware that this session is being recorded. Everyone who registered for the event will be getting an email from us over the next couple of days, and a link to the recording will be in that email. Over the last few weeks, we've had a lot of questions come in, and we will try to get to as many of those as we can. But also, for those of you watching tonight, can submit questions live, either on the chat through the Zoom call or through Facebook Live. And we'll try and get to some of those as well. So let's start off. The first question is a basic one that many, many moms have asked. And that is, how do I keep myself safe from COVID in the hospital during labor and delivery? What if the people in the room before me had COVID? Dr. McCool, what can you tell us about the COVID safety precautions in labor and delivery at the hospital that you work at? I think you're on mute, Dr. McCool. Sorry.
When the COVID crisis began, our hospital worked with the CDC as well as IDPH and our infectious disease protocols to try to minimize the concern of mothers and our staff getting the COVID virus. So what we've got planned is when mothers come in to deliver, they're allowed to be accompanied by one visitor, and we ask that that visitor stays with that mom throughout her hospital stay. Our staff is all screened for temperatures and symptoms of COVID on the way to work each day. The rooms are clean between patients, and everyone maximizes wearing masks in any interactions in the patient rooms, as well as having the mothers and their visitor wear masks as well during the labor process. We've tried to keep the labor experience as close to what it was before COVID, but by adding in those mask, social distance, and cleansing precautions.
Thank you, Dr. McCool. Okay, likewise, once the baby is born, how do we keep the baby safe from COVID while in the hospital is a question one mom sent in. Dr. Turner, what advice do you have for that mom?
So a lot of the same protocols that Dr. McCool just mentioned that the hospital is doing to take care of you while you're delivering your baby are going to be protecting your baby at the hospital as well. So staff temperature checks, masking, minimizing visitors to the hospital, being only the support person that was with you in labor in the room. With those same protocols to protect you, the baby will be protected as well. And we're also keeping the babies in the rooms for everything that they can be in the rooms for, rather than bringing them out to the nursery.
Thank you. Hannah, this next question is for you. Similarly, one mom asked, what are the safety protocols if a mother turns out to be COVID positive at the time of delivery? Is breastfeeding still an option?
Yes, actually breastfeeding is highly recommended, even if mom tests positive. The protocol would be for mom to wear a mask when she's breastfeeding. She should wash her hands well with soap and water. If she doesn't have soap and water, she would be provided with hand sanitizer. If mom is COVID positive, she would be advised to maintain a distance of 6 feet or more any time that she's not breastfeeding. But breastfeeding is definitely recommended even if mom it does test positive. And the CDC has come out with very clear guidelines. If mom tests positive, if her partner tests positive, if mom is exposed, there are many different scenarios, and the CDC outlines all of them. But they do not recommend separating mom from baby.
Thank you.
Or baby from mom.
Right. And as a follow-up, this is a very specific question, but I imagine there's lots of moms who might be in a similar situation on one of these similar drugs. One mom wanted to know what happens if the mother who is on remicade delivers a baby while she is then turns COVID positive, right around the time of delivery. Is there anything to be especially concerned about in that case? As remicade, as you know, can suppress your immune system.
So that would definitely be a question for mom's healthcare provider, as well as the baby's healthcare provider, in terms of specifics, because she's on a specific medication. That medication itself does not prevent mom from breastfeeding. We can look up all medications and all types of procedures in terms of safety for breastfeeding. So remicade in and of itself is not a contraindication. I'll repeat that. It is not a contraindication to breastfeeding. So in terms of the remicade and the immunosuppression and COVID, that's a complicated question that's not for a lactation consultant. And the same thing in terms of the baby's health, in terms of being immunocompromised. That is a conversation to have with the pediatrician.
Well, that's a good segue to Dr. Turner. Do you have any advice for moms who are delivering while on, any immunosuppressants like remicade or some of the others like that, Dr. Turner?
Yeah, so with remicade being safe for breastfeeding in that scenario, I would think that the recommendation would be the same as for any mother who had COVID. So the combination of COVID plus remicade plus lactation should be safe. I mean, obviously there's going to be specifics to that situation, and you'd want to make sure that you're talking to your own healthcare provider to make sure there's not some complicating factor. But baby who's born with mom on remicade would likely benefit from any antibodies they might get from the breast milk.
And lastly, Dr. McCool, do you have anything to add as somebody who's probably treated many others?
Yes, I
immunosuppressants?
do. A couple of things. Number one, a majority of mothers that come down with the COVID infection right before or during labor, a majority of those, almost 70%, are going to be asymptomatic or have mild disease. And that's encouraging only because, at least in our practice, we have not seen any babies COVID positive right after being born. And as far as being on an anti-inflammatory medicine, there's really two stages to the COVID infection. One is the immediate respiratory illness infection, and then there's the kind of the delayed body's immune system reaction against that. And I would suspect that mothers that are on any kind of immunosuppression are probably going to miss some of that late stage COVID disease problems. Certainly it's not going to affect the labor, it's not going to affect the delivery, the route of the delivery in any way.
Yeah, that's good news. It seems almost counterintuitive, but you're right. A hyperimmune response is one of the problems that we see in some severe cases of COVID. And if your immune system is suppressed, you sort of can, forget about that. So, it's a good point. So we've had a lot of questions over the last few weeks about the vaccine. And so there are questions for all three of our panelists. First, we'll go to Dr. McCool. One expectant mom wants to know, what is your opinion on getting the COVID vaccine during pregnancy? She writes, quote, as a healthcare provider, I am not able to quarantine at home and have been offered the vaccine and not sure what the safest route is, unquote. And I guess more generally, another mom asked, what should pregnant women consider when deciding whether or not to get the vaccine? Dr. McCool?
So the current vaccines that are out are a new technology of vaccine. There's been no short or long-term studies done in pregnant women. So we don't really have a lot of information gathered yet to know what the short or long-term effects would be on mom or her baby with the vaccine. However, women that work in high-risk fields, such as teachers, medical personnel, first responders, they're going to be more at risk for getting the COVID vaccine. And mothers that have hypertension, obesity, or gestational diabetes are potentially at more risk for getting more severe disease. The American College of OBGYN and the Society for Maternal Fetal Medicine have both recommended that women that anticipate getting pregnant, women that are pregnant, or women that are nursing should talk to their physician and consider getting the vaccine, even though we don't have any current studies available on the short and long-term effects. And again, the individual patient, if they're at more risk for getting a COVID infection, might be more likely to want to get the vaccine to protect themselves and their baby. If it's a patient that's able to stay home most of the time and they're really not out with a lot of exposures and don't have any risk factors that I mentioned for their pregnancy, they might want to consider not getting the vaccine. But currently, many of our physicians are recommended that all women at least have the opportunity to get that information and decide with their physicians if they need to get the vaccine or not.
Thank you. Very helpful information. As a follow-up, Dr. McCool, I have seen floating around out there on the internet and have heard from some patients a concern that the vaccine can, quote, affect future fertility, unquote. What can you tell us about that?
Well, we have no information right now that fertility is affected in any way by the COVID virus or by the vaccine. So that would not be a concern that we would be concerned with at this time.
Thank you. Good to know. Hannah, the next question is for you. If you are vaccinated while pregnant or breastfeeding, could you transfer the COVID antibodies to your baby?
So that is one of the most beautiful things, and we'll talk about some of the others, but one of the most beautiful things about breastfeeding is that mom does pass antibodies to her baby through the breast milk. But because this vaccine is so new, the answer is we don't know whether the antibodies are being passed from mom to baby. I don't think there's anyone in the trial that was vaccinated, delivered, and breastfed for us to know whether the antibodies were transferred to the baby. It makes sense to assume that it could possibly be, but we don't have the studies to prove it right now.
Okay, thank you. And as a follow-up, do you recommend getting the COVID vaccine while breastfeeding when it becomes available to the general public?
So like Dr. McCool said, the American College of OBGYN has recommended it, especially for those moms who are in the healthcare profession who have a higher risk of exposure. So the recommendations are out there, but the situation is still very fluid because there was no data collected on pregnant and breastfeeding moms when they studied the vaccine. So the general recommendation is if you're in a high-risk group and you're in a high-risk field like healthcare, that you do consider it, but that you discuss it with your pediatrician and your OBGYN before making a determination, because we don't have the data to support it. So
Okay,
difficult question.
right. Thank you. So Dr. Turner, on the subject of vaccination, one mom wants to know, if I'm due in July, if people are vaccinated at that point, do they still need to wear a mask when they meet my baby?
Great question. You know, a lot of the restrictions and the distancing and all of the protective measures that we take matter a lot about, you know, what's going on in the environment around us. So it's hard to say what the world's going to look like in July. I'm an optimist. I hope it's going to be different. I hope a lot of the vaccine will have rolled out. And at that point, we may have rates of spread with vaccine that make it feel logical that, you know, the likelihood of someone having COVID, if they're vaccinated, with low community transmission, there may be different recommendations than we have right now. Currently, with the rate of spread plus a vaccine, the risk would be low, but still not zero as far as we're aware. And so the current recommendation would be to continue our masking and distancing, each part of those being another layer of protection that we have against transmission of the virus.
Thank you. Speaking of masks, let's move on to some non-vaccine questions just for a minute. Dr. Turner, what can you tell us about masking around the new baby just in general? Specifically, when can babies be around others safely? Do you need to wear a mask around the newborn, and if so, for how long? Do all family members need to? And will wearing a mask cause the baby to lack normal, healthy immunity over the long run?
Yeah, so there's a couple different questions in there because COVID is only one part of why we don't want newborns to see a lot of visitors, right? So coronavirus itself, as an illness that your child, your newborn might catch, is not one of the more dangerous infections that we worry about as pediatricians. So the most serious infection that we are trying to protect against would be serious bacterial infections. That's our first main concern. Secondly is going to be the family of respiratory viruses, which include influenza, RSV, and then coronavirus. All of those viruses are more serious in the first year of life, and certainly in a newborn are more likely to lead to hospitalization or serious complications. And those are the ones that we worry about people bringing into the house a little bit more. And so when it comes to masking in that first 2-month period, protecting against all respiratory viruses with masking and social distancing, again, is a layer of risk reduction. Obviously, the most risk reduction would be to not have any visitors, which, you know, is a huge change to what people would expect with a newborn, and may or may not be a layer of protection that different families want to take. But that's obviously the most protective, followed then by masking and distancing, you know, in those settings. As far as masking within your own family unit, like, you know, moms and dads wearing masks, I think even the healthcare workers that I know at this point probably aren't wearing masks at home with a newborn, but it is something that obviously is another layer of protection that your family could choose to do. in your home around your child. It obviously would add a layer of protection there. And then, the children and their immune systems, we see different amounts of interaction with viruses in different families, and it's always been that way. So there are families, their first child is at home with the family for, until 3 years or 4 years, when they start to go to preschool without a lot of interaction on a regular basis with typical respiratory viruses. Along comes a second child who then is getting exposed to the viruses that are coming into the home. Their immune systems develop well regardless, whether they catch all of their respiratory viruses in daycare at 6 months or if they're catching them later. So we don't know for sure. We've never lived through a pandemic like this before or had a flu season like this before with absolutely no influenza or RSV. So we don't really know for sure what that's going to look like in this population of, toddlers and children. But based on what we see in the kids who don't go to daycare versus the ones who do at early ages, the long-term effects should not really change.
Thank you. And just as a follow-up, I want to address, there's a question that came in on the Zoom chat. Specifically, you sort of touched on this already, but I want to specifically answer this mom's question. What recommendations do you have about having a sibling go back to preschool daycare after the baby is born in this setting of the pandemic?
So, kind of going back to the respiratory viruses, there are times in the past where in a really heavy influenza moment or really heavy RSV situation in a newborn, particularly who may have higher risk factors like who was in the NICU or has some lung disease, cardiac disease, where we may have made the suggestion to a family, if you can keep your child home from daycare and still keep your job, because that's very important, right? Then this might not be a great time to be sending the 3-year-old if you can keep them home. That being said, the risk of contracting COVID or influenza or RSV in a daycare or a school that's taking the appropriate measures of masking the adults is very low right now. Transmission within schools and daycares has not been a driving force of this pandemic that we've seen. Almost all of the patients that I've seen who've gotten COVID have gotten it from parents, from friends, but the daycare itself right now is unlikely to cause you to bring COVID or really any respiratory virus home.
Thank you. We've been getting a couple of questions from the Facebook Live portion, which most of you cannot see on the Zoom call. So I'm going to ask Dr. McCool to answer these because they're about vaccines. We're going to go back to that topic. A very basic question. If a mom gets the vaccine and develops a fever as a side effect, can that negatively impact the baby?
Generally, I would say no. Fever reaction is one of the more common reactions that potentially could happen with the vaccine, but mothers can safely take Tylenol before, during, and after they receive the vaccine to mitigate getting a fever. And generally, a low-grade fever is not injurious to the fetus or to the mother if it's not prolonged for many, many days. And generally, these fevers are not very high. And like I say, Tylenol would certainly be a good option before the shot and then after it's been given to make it safe to get that shot.
Thank you. And then a very specific question, but related to the question we had earlier about remicade. One mom writes, I'm on an immune suppressant called Stelara. Do you think pregnant moms should get the vaccine if they're on an immune suppressant medicine? And would that mom be considered a high risk since she's on such a strong medication? Dr. McCool?
So there are some considerations for people if they're on immunosuppressant drugs. They can still get the vaccine, but their body's immune response may not be as full as somebody that's not on an immunosuppressant. So I think the decision really would be between the patient and her doctor for her specific situation. But there certainly wouldn't be any reason not to get the vaccine, even if she was on an immunosuppressant. It's just, again, those are one of the considerations, that the shot may not be as effective, and the mother might choose to elect to get that shot or not because of that.
Okay, thank you. Hannah, one mom asks, is it safe to get milk from a milk bank during the COVID pandemic?
So milk from a milk bank is pasteurized, which is why it is safe to get milk from a milk bank in the first place, because they definitely ask mom a lot of questions about her past medical history. They do a lot of testing, just like they would for a blood bank. And then they pasteurize the milk. So in the pasteurization process, if there would be a chance of this virus being in the milk, which as far as we know, it doesn't happen, but if it were in the milk, the pasteurization process would kill the virus and would not pass the virus on in the milk that you pick up from the milk bank.
Thank you. And I want to clarify, just for those people who aren't clear, can you tell us how a baby gets COVID from the mother? Is it through the placenta in the blood, or is it some other way, the respiratory way?
So all the studies that we have of babies who have tested positive for COVID after delivery have been through respiratory spread, not in utero, not through blood, not through during delivery. It's only respiratory.
Right. So that's I think a good point to emphasize to all the pregnant moms out there, that if something were to happen and you were to get COVID during your pregnancy, that there's really no evidence that this passes what we call vertically from the mom to the baby through the placenta. It's only after the baby's born, comes out, and then gets the COVID virus like everybody else on the planet from a respiratory perspective. So that if you are good about masking and trying to limit that sort of exposure, then you can prevent COVID in the baby as well. So good to know. Thank you. All right. Dr. McCool, you spoke about what happens during the labor and delivery phase, but let's take what should the mother do before she even gets to the hospital? Is there a quarantine or an isolation phase that you recommend as an obstetrician?
So currently around the country, there's different protocols. And what we've been recommending is, if you stay at home, self-quarantine 1 to 2 weeks before your due date or an anticipated date of induction, that seems to be a fair amount of time to avoid the risk of getting the COVID right before going into labor.
Thank you. And likewise, Dr. Turner, a specific question came up. When a baby comes home during this pandemic, is there a need to quarantine the baby after they come home?
So the baby will have had the same contacts basically as anyone that else is coming home with them. So they really will only have seen the self-care team and parents and support person. So they'll be going home with pretty much the same people they're around. So they don't have like a specific quarantine because they're in the hospital. Hopefully the procedures we have in place avoided any contact with a COVID positive person. So both the parents and the child should not need to quarantine from family members due to the hospitalization.
Okay. Dr. McCool, a question for you. You spend a lot of time in the hospital, obviously. Is in your hospital, and I understand that things may vary from location to location, But in your hospital, is there any restrictions on what happens if a baby has to go to the NICU, the Neonatal Intensive Care Unit, on whether the mom and dad can visit?
So the first thing is when the moms come in to deliver, if it's a scheduled induction or a scheduled C-section, they'll actually do an outpatient COVID test 2 days before the admission. So that way we can pre-screen. If anybody's positive, then there's a certain protocol for those moms when they come in to protect the staff, the mom, the baby, their families. Babies that go to the NICU will get the standard care, and they will let the parents into the NICU because the mom had screened negative on entry, or if she came in labor and had a negative screen, and the father didn't have fever, recent travel, all those risk factors for COVID, then they are allowing those families that mom and the dad to visit their children in the NICU. Now, if a family is COVID positive at the time of delivery, it is preferable not to have the COVID positive parent or parents into the NICU itself. So at our hospital, we don't separate the moms from their babies if the mom is COVID positive when she delivers. And we do tell our moms the only time they might be separated from their child is if the baby has to go to the NICU for some reason. They won't let a COVID positive mom or dad into the NICU itself. And that protects their baby and all the other babies in the NICU as well.
Right, well, that makes sense, obviously. Okay, thank you. Now, COVID isn't the only disease you need to worry about with newborns. One mom asked, can the grandparents hold the baby if they've been vaccinated against COVID, the flu, tetanus, diphtheria, and pertussis, etc.? Dr. Turner, what can you tell this mom?
Yeah, so, that's a well-vaccinated grandparent, which is great. We're always very pro-vaccine in the pediatric world. So, so that's really great. And they, follow the recommendations of getting that updated Tdap, which is really important for visitors for that extra pertussis protection, and then our flu shots, right? It goes back to what are the risks? And so depending on what time of year it is and where we're at currently, if this is a question for right now, the COVID vaccine right now, we're not sure about that small percentage of people who contract COVID after vaccination, what the likelihood of them transmitting their mild or asymptomatic case of COVID is to someone. Preliminarily, it looks low, but we don't know for sure. And so that's how medicine works. Sometimes it's hard and slow to get those answers, and people are looking at it. But the vaccine right now is not a guarantee that we won't transmit. It is the same with a flu vaccine, right? I mean, so the flu vaccine prevents death from flu. It doesn't prevent you from contracting flu. The current low flu season is probably preventing you from contracting flu, but that is again just a layer of protection. So currently, the recommendation for a visitor holding your child would be to mask. Obviously, distancing doesn't involve holding, but each of these layers are one more protection. And so making those choices as to which layers to protect your family in this current situation, the risk is low, but it's not zero.
Thank you. And speaking of other diseases and other infections, Hannah, for those who may not be aware, what can you tell us about the benefits of breastfeeding in terms of disease prevention?
So we know that one of the beautiful benefits of breastfeeding is that mom provides immunity to her baby through the breast milk. So anything that mom has antibodies for, she will share those antibodies with her baby. So if she's had the chicken pox, she has antibodies to the chicken pox, she will share that immunity with her baby through the breast milk. Another beautiful aspect of breastfeeding is that if the baby is exposed, let's say to a cold, and doesn't show any symptoms yet, but when they nurse, through their saliva, they send signals to mom's body to actually make antibodies to these germs that they've been exposed to. And mom, her body can then make those antibodies and pass them back to the baby through the breast milk. So it is very, very unique in terms of how much protection breastfeeding gives to the baby, specifically in terms of prevention, and the antibodies that mom shares can't be gotten anywhere else, only from mom. Until baby is ready to be vaccinated themselves, the only protection they have is the antibodies that they get from mom.
Thank you. And, I'd just like to step in. I'm not a mother. I've never breastfed, but I've been doing this for almost 30 years. And so I do want to point out to everyone that, breastfeeding is not a binary status. It's not, it's all one or it's all formula. Any breast milk a baby gets, however the baby gets it, is good for the baby. If you can breastfeed 20% of the time, 40% of the time, 60% of the time, or 100% of the time, great. We certainly encourage a full-time breastfeeding, at least for the first 6 months or so. But whatever you can do, it will help your baby. So, don't feel guilty if you can't do it completely 100% of the time, and don't let anybody talk you out of it at all. If you're interested and you want to do this, everything you can do, it will help your baby. So just wanted to put that out there. Okay. The next question, so how much this pandemic affects all of us in lots of different ways. This common question is the new twist, and it's Dr. Turner. One mom asked, how do I help an older sibling? Older child is not interacting with others due to the pandemic. We're a little worried about the transition. Sib will be 2 years old when the baby grows up. So, Dr. Turner, does this mom do anything different than what other mothers have been doing for years?
Yeah, so you're breaking up a little bit for me, so I'll repeat the question a little bit. It sounds like it was a question about a new baby coming home to a sibling who really hasn't had a lot of exposure at this point because of the almost year-long isolation of a pandemic.
Right.
A 2-year-old having a new sibling come home is always a big change for a 2-year-old. So, especially if they're the oldest, their exposure to other children may not have made a huge difference in the way that they react. I would recommend the same things that we would typically recommend, which are talking about the new baby coming, showing pictures of babies, maybe some small videos of babies to kind of, take the place of that, visual interaction of seeing what a baby sounds like or hearing what a baby sounds like, and those kinds of things. And then, 2-year-olds, they react in a couple different ways. Some of them are very nonchalant and really just kind of ignore their sibling. And then some are just all over them. And your job is feed and protect for months. Just kind of keep that 2-year-old away. The main reason they're doing that is more about parental attention than their understanding of other children. They've lost that, instant one-on-one constant, satisfaction of your attention. And that's what they're looking for more so than anything else. So provide that attention when you can. I like to also talk about using first then with new siblings. Start before the baby's there. First I do this, then I do this. First mommy takes a drink of water, then I hand you your snack. If you do that and you always follow through, they start to learn there's a little bit of a wait. They don't understand time, but there's a little bit of a wait that's going to happen here, but mommy's going to follow through or daddy's going to follow through. Okay. So first I do this, then this, and that helps with that kind of, impatient toddler instant attention that they always are craving.
Thank you for that. Okay, Dr. McCool, we had a couple of questions come in about masks on the Facebook Live and the Zoom chat. So I'm going to ask you two questions. One is, does a expectant woman need to wear the mask during labor? And what do you do if she can't wear a mask? I'm not sure exactly why she can't, if she feels it may be inhibiting her breathing or what, but can you address those two questions?
Sure. So we covered this question a dozen times a day in our OB clinic. We've really tried to prepare the moms for what to expect for any labor and then labor during a COVID situation. So we do ask that the moms wear the mask during their labor as well as during the stages when they're pushing. Now, when I tell moms that, I always get the same look of incredulous look, like we have to wear the mask when we push, but everybody does it. By the time the moms are pushing, there's so many other things going on that they really don't seem to mind or notice that the mask is on during the pushing stage. But we do ask that the patients try to wear the mask as much as possible. That helps protect baby, that helps protect our staff. And we found that it really hasn't been as big of an issue when you get down to doing that as it sounds like when you're talking about it and making prenatal plans in the office.
Thank you. Okay. Likewise, the pandemic has caused all of us to find new ways to service our patients. Hannah, are lactation consultant appointments in person or are they virtual?
Ideally, the lactation consultant visit is in person, just like the new baby will be seen by the pediatrician in person. Most common concerns for a lactation consultation are painful latch or poor weight gain, and those really can be managed much better in person, hands-on. We do wear PPE, we do wash our hands, we do spend a lot of time with mom and the baby, but we're very careful with our PPE and our hand washing. Our rooms are clean, our rooms have air purifiers, and they're not used for any sick visits of any kind whatsoever. So it is definitely ideal to be seen in person. If mom is COVID positive, we will do our best to help mom via video call, telemedicine call, and do our best with whatever props and videos we can help. We will do the best we can to help mom until the time when she's well enough to come in and see us in person. But the ideal is to be seen in person, so that we can be as helpful as possible, hands-on, helping with the latch and actually weighing the baby before, during, and after the feeding to see how much milk the baby is transferring. And that speaks a little bit to what you were saying, Dr. Rucoba, about it doesn't have to be 100% breast milk. If we find that for whatever reason, mom is producing 50% of what the baby needs or 75% of what the baby needs, or we will work with mom to help her maximize the potential of her breast milk and come up with a care plan to help her know how much she needs to supplement the breastfeeding so that the baby is gaining weight appropriately. But that's a real benefit to seeing a lactation consultant is knowing how much milk is my baby getting, and do I need to give the baby anything besides what they're getting at the breast.
So, two points that I would state based on what you just said, Hannah. And the first one is, you're right, some things can't be done virtually, and that's one of them, right? It's nice to see how it goes, guide the nipple, guide the breast into the mouth, see exactly what's going on, reposition. You can only do that hands-on. So that's great that you're doing that. And then the second thing is that, and this is sort of shameless plug for our lactation consultants, who I think are wonderful, that I've worked with lactation consultants for years now, and not all of them have that attitude. So I have seen lactation consultants be somewhat fascist about it, and it's all or nothing, and this is the way it is. And but I know, working with you and your team, that Goal number one is to get the baby to grow and be as healthy as possible. And goal number 1A is to do that with breast milk, but you're not going to skip over goal number one. So however the baby can grow, that's the bottom line. So
Right.
for those of you out there who think all lactation consultants are going to be hard-nosed and drill sergeants, that's not the case with those at PediaTrust. So rely on them. They can do you a world of good. Okay. So another question that came up, and this one is very basic for Dr. McCool. One mom is wondering if the postpartum visit schedule or frequency is altered due to COVID.
So we've tried as much as we can to allow moms to come into our clinic and to do their 2-week visit for C-section and their 6-week visit for a postpartum check. Because again, there are hands-on things that we can do to help mothers out. If a mother is doing well, she's had babies before, and she's comfortable and wants to do telehealth medicine, there's no problem with doing that as well. And then that really is more generated by the individual patient and how she does in her postpartum recovery. But we do encourage the mothers to come in if they're able to and feel comfortable doing that.
Thank you. Dr. Turner, this is a good question from a mom. At what stage is a baby's immune system developed enough to be able to fight COVID?
That's a good question. So, and this goes back to that visitor, Mark, too. So I may not have mentioned, I'm not sure when we was talking before, because it was a multi-part question, but generally pediatricians use a 2-month mark when we're talking about visitors. And at that 2-month mark, the major change is how we look at fevers in a pediatric patient. So under 2 months of age with the fever, we're worried about serious bacterial infections, and that's the part of an infant's immune system that really isn't developed. So they have 2 parts of the bacteria fighting part of their immune system that don't work well. They don't make pus very well, which can be a problem. And they also have a really hard time with bacteria that have a lot of sugar as a capsule. We start vaccinating for those bacteria at 2 months. But prior to that, bacterial infections from birth that they may get, the only symptom we may have because of that immature immune system and just by virtue of the baby's cry and sleep, and there's not too much else that they can really do to show us, we may only have a fever as a sign of a serious bacterial infection. And so so that's the part of their immune system that's a little different. The reason that they have a really hard time with other viruses, so that under 1 increased risk from respiratory viruses, is going to have more to do with the way that they breathe. Newborns only breathe through their nose at first, and so anything that's getting into the nose, nasal mucus or swelling from mom's estrogen, all of that kind of can impact their ability to breathe. And they're not very strong when it comes to coughing. So if you think about what a newborn looks like, they've never done a sit-up. They have those nice kind of bellies that kind of flop out. So they don't have a lot of abdominal tone for a really good hearty cough like an adult that kind of moves that mucus around. So laying flat on their backs with their noses full of mucus, they really don't do well with viruses. As far as risk specifically from coronavirus, up until age 1, there's a higher risk of more serious disease from coronavirus. It's still very low. The pediatric population, we've been, a silver lining, coronavirus is not causing significant serious illness in children right now. So the under 1, it is more, but it's still low.
Thank you. Hannah, this next question is for you and came in live tonight. Following up on our discussion about all the immunosuppressants that many pregnant women are on, I knew that was going to be a popular topic. So they want to clarify, if you're on an immunosuppressant medication, does that make the baby's immune system weaker when you're breastfeeding while still on that medication?
So the Bible for medications is written by Dr. Thomas Hale. And Dr. Thomas Hale has evaluated pretty much any medication. He updates his book every 2 years, and he goes through every single medication. It would be medication specific as to whether or not it passes through the breast milk to the baby. There's not a general statement that says all immunosuppressants are good or bad or pass through the breast milk. It's based on molecular weight, if we remember our high school chemistry classes. Molecular weight, it's based on particle size, it's based on half-life, it's all chemistry. But you don't have to worry about that, because if you're on a medication and you want to know whether it's safe to breastfeed, all you have to do is ask, and we will be happy to look it up for you. We have that book at our fingertips, and we will look it up. Any medication you want, we'll look it up for you. But don't let anybody tell you that it's bad and that you have to pump and dump until you ask, because a lot of people don't take the time to look it up. Radiologists don't take the time to look it up. Pharmacists don't take the time to look it up. And they will be very quick to say, oh, just pump and dump, as if it's nothing. So ask. We'll be more than happy to look it up.
Thank you. This one is for Dr. Turner, and it's very specific to COVID. Well, my baby is 5 months old. We're being very conscientious about who we're seeing, and the baby is only used to mom and dad and siblings. How can we reduce separation anxiety as she gets older? Unquote.
Yeah, so there's a couple different periods of separation anxiety in pediatrics, and the first one is coming up, and that's going to happen whether it's an only child who's never around other people, or if you've got 15 kids at home. So the first one has more to do with object permanence and understanding mom's in the room, mom's not in the room, dad's in the room, dad's not in the room. So that's when we see a lot of parents will call it the sleep regression around 6 months or 9 months, where a baby wakes up and cries because there isn't someone right next to them. And so that one's going to happen with the 5-month-old coming up, and there's not a ton to do. It's an important developmental milestone that helps them understand their sense of self, and I'm a person, and mom's a person, and dad's a person. Separation anxiety in a little bit older children tends to seem to be kind of personality dependent a little bit. That kind of separation anxiety may be higher in this scenario where we don't see a lot of people. And just like anything with kids, the key is really prepping them and making sure that they have an idea of what's going to happen. Harder when their vocabulary and their receptive language isn't as good, but when you're talking to a kid who may be seeing grandma for the first time, or maybe going to daycare for the first time, make sure you've shown pictures and told stories about the situation that's going to be happening. So grandma and I talked about how much you like your bunny, or Miss Susie from daycare and I were talking about how you like bananas. So what you're trying to do is help your child understand that the person that they're seeing is someone that you know and trust and that you like, and even trying to forge a pre-relationship that this person likes you and I trust them to be around you. That's kind of where you would start. And then your child may surprise you. They may be a kid who is, just ready to fly and is excited about the world, and then, or they may not be, and they may be one who wants to kind of hang back, feel secure, and kind of do the runaway, come back kind of method of learning about the world. But both end up working well for the child who uses them as a method. It's just a matter of making sure that you are prepared and prepping them as much as possible.
Thank you. These next two questions are for Dr. McCool. I'll ask the first one, and it's about the vaccine and pregnant women. First of all, are there any data actively or currently being collected or studied on the impact of the vaccine on pregnant women right now?
So the protocols for the vaccine did not include pregnant women in that, but there have been maybe 3 or 4 dozen women that got pregnant after the first or second shot, so that are in those studies. So they're actually following those women that happen to get pregnant right after or receiving the first or the second vaccine. Right now, these vaccines are so new, we don't have any short-term data, we don't have any long-term data to really make that information clinically available. We're going to need more time, and we're going to need thousands and thousands of women that have gotten the vaccine that would be followed after that. So I think it's just way too early to tell. The advantage is at least we've got the vaccines available in a very quick manner from when this COVID pandemic first hit the world.
You're right. And the second question is this. Are pregnant women likely to be considered in the phase 1C, defined as under 65, but a vulnerable population? Can pregnant women elect to be in that prioritized group for vaccination? For context, the mom who's asking the question says, I am an otherwise healthy 30-year-old, so if not, she'd be in the very last group to be vaccinated.
Now, that's a very good question. As it stands right now, pregnancy is not a factor that gets you the COVID vaccine sooner than the other people. Right now, the COVID vaccine is based more on the high-risk groups of doctors, first responders, and people over the age of 65 or 70. So it's more the folks that are either at risk for getting the disease because they're in a high-risk environment through their job, or the people that are homebound in nursing homes or elderly that really need to get the vaccines in. So like I said, pregnancy right now is not a part of that stratification.
Yeah, thank you for clarifying that. All right, so there have been a lot of questions, both that got sent in before tonight's session and on the live session tonight about vaccines. And so I'm going to take this moment to let everybody know that our next Ask the Pediatrician Q&A session focuses exactly on that, and that is COVID-19 and the vaccines. Now, it's going to be mostly from a pediatric perspective, but since our youngest patients, those under 16, can't get the vaccine, many of our doctors are fully aware of who can get the vaccine, our older kids and adults, whether it's themselves, their families, their parents. So we're well versed in this. Vaccines is what we do every single day. So be sure to tune in for that session, which will be held on Thursday, February 11th. There'll be information about that, I think, either in the email or certainly on our website, PediaTrust.com. As I mentioned at the outset of the session, I'd like to respect everybody's time, so we're hitting on 7 o'clock very soon. So I'd like to thank our guests tonight, Chana Goldstein, Dr. Melissa Turner, and Dr. Randy McCool. Thank you all. This has been very illuminating. I've been here myself tonight, and it's been hopefully edifying for all of you as well in the audience. Again, the session was recorded, and an email will be going out to everybody who registered recorded. So be sure to pass that on to all of your friends who are pregnant or thinking about getting pregnant, because there's a lot of good information here tonight. All right. Thanks again to everybody, and I hope everybody stays safe and healthy. Thanks so much.
Thank you.
Thank you.